One quick announcement, don't forget when you send in questions via the chat box, make sure you send those to everyone, or you can use the Q&A box as well. And so I will turn it over to you, Val.
All right, thank you, Heike. Let me write down one thing real quick. Sorry, 28. Yes.
Well, while you're writing.
I'm transitioning, so give me a second. Yeah.
Okay. I'll remind everyone, don't forget, we are doing these webinars every 2 weeks, not every week like we had been. That started beginning in August. You'll find on our webpage, on the COVID page for the registration, that we have changed that from weekly to bi-weekly, and all of the registration links are available through December 2020. So you can get a jump start on the upcoming webinars and get registered for those.
All right, thank you, Heike, and thank you for getting all that set up on the calendar. If we do need more of them, we will set up more of them, just so everybody knows. Every week when I think about this call on Thursday, I'm thinking, we don't have a lot. And then we get started on the agenda, and if you can see my paper, it's all blue now from all the ink I wrote on it. So I speak quickly, so we got that in our favor, right? I wanted to give you a Fusion Cell update real quick. I don't know how many of you opted to use the Battelle system. That is the system we use to clean the N95 masks. It really never took off as a huge, we didn't really ever have enough business in Missouri to really support a whole Battelle system in the state. So while the Missourians will still have access to a Battelle system, and if you are a provider that's using a Battelle system, you will still be able to access a Battelle system in another state. They will just, instead of shipping your mask to Jefferson City, you'll be shipping them to another state. So it may take another couple of days to get them back, but it's still better than throwing them away if that's your masking option. And that's, again, only for your N95 respirators at this point. That system's demobilization will be final by September 12th, but at that point, they will then shift Missouri's N95 masks to other Battelle systems across the country. Also, vaccine. The vaccine, we get a lot of questions about the vaccine. And I even can't remember where I say what I say, so I'm just going to say it all again. The state is working on a vaccination plan for the COVID-19 vaccine when it becomes available. Please know that that is going to be federally, very heavily driven by what the federal government tells us to do. So I just want to make sure people are aware of that. There will be some ability to make some parts of that plan Missouri specific, but please know that will be very heavily driven by the federal government and what they want us to be doing. With that said, a couple things I think people need to hear about the vaccine. One, the vaccination is going to be a 2-dose vaccine. There's not a lot of those out there for adults right now, but if you're a kid, you're very familiar with a 2-dose vaccine. If you just had a baby or know someone who just had a baby, you're very familiar with a 2-dose vaccine. But what that means is you will have to get 1 dose, and then 3 weeks later, you will have to get the 2nd dose of the COVID vaccine. Also, you cannot get 1 dose from one provider and get the 2nd dose from a different provider. And that doesn't mean provider, that means the person that makes the vaccine. Right. So if you get the 1st dose from Johnson & Johnson, that's who made your vaccine the first time, you have to get your 2nd vaccine from Johnson & Johnson. Also know everything I tell you around vaccine is completely subject to change because we're still very early in all of those processes, but those are the things that we have been told up to date. So I wanted to make sure you guys know that the state of Missouri is actively talking about COVID-19 vaccination and how we get it done, and that's across the board from how we communicate it to our residents all the way to how do we actually get it into the arm, leg, thigh, I'm not even sure where it's going to go, muscle of everybody who gets it. So stay tuned on that, and I will keep you posted. In fact, we may kind of make vaccine just a call out for us that we talk about every time because I know how important it is to everybody. Just to give you an idea of where we are in the community in terms of the number of individuals that access our waivers or use the DD system in Missouri. As of August 28th, we have 267 positive cases, we have 8 deaths, and we have 89 providers that have been affected by COVID-19 at this point. I will tell you that our August numbers as of today are lower than what our numbers were in July in terms of people that have tested positive. So that is good. That's what we want to see. I will also tell you that in our statewide facilities, this is both for the Division of Behavioral Health and the Division of Developmental Disabilities, we had 0 positive residents in the month of August so far. We got 4 days left, so that can change, but as of today, we have had 0 positive residents in the month of August for the division. So that means those things that we talk about that are so important to do, testing, wearing a mask, screening your employees, screening your residents, all of those things really do make a difference, and you really, really can protect people from COVID. With that, we'll move on to testing because I love to talk about testing. I know big announcement today in the state of Missouri. Yesterday or this week, Washington University has developed a saliva test that the FDA has approved. That's amazing because we all know the testing can be relatively invasive. It also takes a lot of hours to get done, and getting results is tricky. So if we can do more quickly, that will be great. So the good news is we have that approved. Next step is actually getting it deployed. So just because it's approved does not mean it's deployed, and that's what we will be working on, is that deployment. So as we learn more about that, we will be sharing that with you. One of the things that WashU has developed the test, and now it's getting all the other labs to adopt the test and actually use the test. And I think that's one of the things that we run in. People hear about, oh, we could do a test this way, and it doesn't have to be all the way up scratching your brain. You can do it that way as long as you've got a lab that will run the test. And so we talked about that early on, how there's kind of 3 pieces to testing. There's the supplies, there's the labs, and then there's the people that will actually can perform the test if it's not a self-administered test. So again, all those pieces have to be in place before you can actually move to changing the type of testing that you're doing. But it is very, very positive at this point, and we wanted to make sure you are aware that there are, we've been talking about it since June, but it really does now feel like realistically it could happen relatively quickly. The other thing that we hear a lot about, and I'm sure some of you, especially on the provider side, who may have employees or who work for skilled nursing facilities on the side, or you may be a part of organizations where your skilled nursing facility providers are active in those organizations with you. The skilled nursing facilities across the country, every one of them in the country, will be receiving an antigen testing machine. So it's a box, and it's a rapid test. And that rapid test, so they'll be receiving the machine that can complete the rapid test, and they will be receiving the test kits for that rapid test. We still don't know if they're going to, they will also be given requirements of how, based on positivity rates in their community, how often they should be doing testing of staff and staff/resident combinations. Again, that depends on their community positivity rates. So know that is going on around you. There are lots of challenges with getting that antigen testing up and running, and a lot of responsibilities that come with being a person that is actually doing the testing on a location. And some of those challenges include there is a requirement that you report all of your results, whether those are positive or negative, to the state. And if you're running 500 tests a week, you've got to have somebody that can report all of those results to the state, and it's an electronic reporting process. So when you're thinking about, I want to be a part of this, I want one of those antigen boxes, it comes with its own challenges, and we want to make sure people understand that. The second thing that you have to do is you have to get a waiver because you are now officially operating as a lab, and there's a federal requirement that you get a waiver that says you can do that without meeting all of the other lab requirements. So there's a lot that goes into all of this testing, and those are things we're really trying to figure out right now, especially on the antigen side. We like the antigen test. We think if we could figure out how to make that work, we definitely could open up opportunities for visiting. There's some things that we could do, but there are some weaknesses to the antigen test. The antigen test, if it shows you, is not really considered a final test. So if someone is positive and they're symptomatic, you wouldn't need to retest them. But if someone is positive and not symptomatic, you may want to retest them. Also, negative doesn't really mean anything on an antigen test. So those are some of the things, because there's a lot of false negatives in the antigen world. So those are just some things to think about. I know it sounds good when you read the headline in the paper, but there is a lot that goes into that whole process. So we want to make sure people understand that. But we We're not saying you shouldn't do it. We're just trying to figure out what's the best way to do it and make sure everybody understands what that all includes, because I don't want anybody to get in trouble. If labs don't report, they get fined. So you don't want to think that you're doing a great thing for your facility, for your residents, for your family members, and then find out you owe $8,000 on top of what you spent for the testing supplies. So that's why we want to make sure you guys really understand what goes into all of this. The next thing we're looking at is a budget update. I don't really have a budget update at this point. I mean, the department's working on our budget request. There is no money. The revenue report will come out next week, so stay tuned. Also, Congress has not made any forward action on any relief to states at this point, so I got nothing for you there. The CARES Act funding, so that's the state funding, the $20 million of state funding that's available for group homes, ISLs, day and employment providers. Day and employment providers get a business interruption grant. ISLs and group homes submit invoices. You have attestations you have to sign. All of that now has to be submitted to the state by November 15th. So that deadline has been moved up. So I want to make sure everybody's aware of that. We will be doing a lot to post information about that.
But the amount available is still the same.
Yeah, the amount available is still the same. My goal has always been to have it all spent before November 15th anyway, because I know you guys need it. But if you're waiting because you think you're going to have more information, it's September right now. It will be November 15th before you know it. So do not wait. The other good news is there's that federal funding that we have been talking about over and over and over again, whose deadline continually gets extended, and it got extended again this week. So that deadline was supposed to be August 28th. That has now been extended to September 13th. And that's the funding for Medicaid providers. So we know all of our providers are eligible for that funding. You have to go online and you have to apply for it through the federal government. That is not a state program. So if you have not done it, you've now got until September 13th to do it. And we keep reminding folks, you cannot tell me how much you need money if you're not applying for these programs, because we're going to know who applied for it. We're going to know how much money they got. And so it's really, really important. You don't get to cry if you don't apply. Oh, it's like it's a slogan. It's a slogan. I just did that. Wow. I'm really sharp right now. I should probably
in politics.
I should probably quit while I'm ahead. Anyway, I wanted to make sure that you guys understood that on the funding side. Also, if you did receive any funding in the early rounds from Medicare, and we've said this over and over again, early on they told you you weren't eligible. You are now eligible for this funding. So please, please, please make sure it'll tell you if you're not eligible. So just make sure you apply. Try anyway. I mean, we had Gary trying, and then one day it finally broke through the system and he got an email and said it worked. So just remember, you got to try. Okay. The other thing I wanted to say on testing, and I have to go back up, we will be starting, we talked about this a lot in June and July, where we were doing community-wide testing across the state. That is going to be resuming again on September 14th. There is a plan currently that we're working on around that. There are two pieces to that. Specifically, they will hopefully this is ideally what we want to do, is testing in certain cities in the state. Just, let's say you live in Columbia. Columbia would have a testing day, and that would be every week. And that testing day, I'm making this up right now, but that could be Tuesday. So every Tuesday in Columbia from 10 to 4, you could go get a COVID test. And that will be really, really well known. Now, we don't have that schedule worked out yet, but as soon as that's worked out, we will share that with you. But that's part of what we want to do on testing. And then the second part of the community testing plan is to focus efforts where we see high positivity rates and low testing volume, so that we can get into those communities and help mitigate the spread. To give you an example of how important this community testing is, and you guys will remember, some of you will remember McDonald County. So McDonald County in the southwest corner of Missouri, bordering Arkansas, had major outbreaks in food manufacturing, and that was in June. And they are now to the point where we are close to moving them from remote only back to in-person visits, outdoor in-person visits on case management. That is how much their case counts have gone down, and they did substantial testing in that area. So it makes a difference if you can do that. Also, they did a really good job of listening to the instructions that we were giving them on what they should do to help mitigate spread. So just want to make everybody aware of that. Those testing opportunities will be available, hopefully, again, starting September 14th. There is a question that we got early on, so people are still, as always, you can submit questions before, and we do highly encourage that because we want to make this call as much about what you want to hear as what we want to tell you. And this one actually came from an actual support coordinator, not an agency or a provider, but a support coordinator. And that support coordinator asked the question, when will support coordinators start going back into consumers' homes to visit them? I know the map showing the counties that are remote only, but how long can this go on? I'm for continuing social distancing, wearing masks, washing hands, and I make stops only for bathroom breaks. So I love this question because I want you in those homes too as much as you want to be in those homes. Remember, we do remote only because of what's going on in the community, not because we think even the outdoor visits are a high-risk visit. At the same time, if you as an agency and as a support coordinator and the provider and the family are all ready to do in-person visits, we're not saying you can't do that. That's not something we've ever said, especially if you get how to do it responsibly and you are following those rules. We totally support doing those today if you can make all those right things happen. And we want to get everybody, if you guys get there before I get there on paper, that's fantastic. But just to give you an update, we got 378 people on the call today, so that's really good. And I'm going to move it over to Angie at this point.
Okay, so for CARES Act funding, okay. So for CARES Act funding, we did have a question about whether or not it can be used for technology for self-directed services for those families using that. Missouri is the billing provider for those services, so we have included that in our request that Val talked about earlier that Gary submitted. So we are working on that process. As we get more guidance, we will make sure to update that and let families know as well, but we are trying to apply for that piece of it. We also have another question here asking if anyone that applied for federal CARES Act funding, do we know that they've actually seen the deposits? And we can say that we have heard that providers are receiving those deposits. And then finally, non-COVID related waiver renewals. We want to thank everyone for all of your questions and comments that you've submitted. That closing date was August 17th. We are in the process of reviewing all of those, developing the answers. You all did not disappoint. I think we have over 70 pages of comments and questions, so we appreciate the feedback, and we'll be working on those and making any adjustments as necessary, posting those, and our goal is to get those to MoHealthNet by September 10th. So I will pass it on to Wendy.
I just have one quick thing. If you were on the Stories from the Field call, I think Dwayne introduced a new tool to you about, it was like a risk assessment or a readiness tool for returning to the community. We are going to be making that available on the website, probably at least in draft form, hopefully today, and then finalizing maybe some details depending on the feedback that we got back. But several people had asked for that tool in advance of it becoming final because they're in the process of developing such a tool or whatever. I think it was really well done. Actually, we took it from another state and then we customized it to Missouri, and I think Dwayne might have added some questions on there, but it will really help you as a support coordinator or a staff member or a family member sit down and see where the risks are for the individual in getting back out into the community or going to work or going to day program and starting to get comfortable around that. He'll provide you with that context about, okay, here's where the worry is or the concern is, so here's the risk we need to mitigate. So look forward to that tool. It is not required. It is just there to help you if you find it useful. But we got pretty good feedback on it, so I'm hoping that you all will find it useful as well. And that's all I have, so I'm going to hand it off to Kim.
Thanks, Wendy. Just want to quickly acknowledge ongoing efforts by everyone at every level to continue the efforts to stay educated and informed and ongoing prevention and planning in making those important decisions on a daily basis. We're making some efforts in continuing to be efficient and effective in regards to everyone reporting those individuals who may have presented positive for COVID-19 test results. Work closely with our colleagues over at DHSS, and they have initiated a new platform in their system for reporting of electronic COVID-19 case reporting. Be looking for some revisions to a memorandum that we have within our division for reporting COVID-19 positive participants with test results. We're going to be taking away Appendix A, which our residential providers have been reporting information on, and this is an example of efficiency and effectiveness. Now, if you can go to that electronic link, which we will provide in the memorandum, that's kind of where you'll be reporting information, and then just in addition to the event reporting. So again, thank everyone for continuing all of your efforts. And then just lastly, just as a reminder, I know information is changing sometimes on a daily basis. There's a lot of information posted on both DHSS's website, CDC, and ours. A quick shout out, CDC did post a while back some information that was specific around COVID-19 for individuals with intellectual and developmental disabilities, as well as to direct support professionals and for providers of group home services. And so those are really good resource information places.
No, you're good. You keep going. I want those two to look at me.
Oh. I have a little activity happening in Val's office right now.
Playing a game of charades.
So just again, if you haven't signed up for the email blast from the division, please make sure that you do so, because if we come across additional information, what Val was referring to earlier in relation to activities happening tied to the COVID-19 and vaccines, as well as testing efforts and information that becomes available, when we update and revise information that we have posted out on our website, we're sending that notification out through those email blasts that Heike is managing. So just a quick reminder, please, if you've not signed up for those email blasts, please do so, because that's how you can be certain that you're staying up to date on the most current information that we have available that we're posting. And so with that, I think I'm going to, do you guys have any other?
I do have some more. So I just got one in on the Q&A. We've got one, we're going to respond to somebody directly, just to make sure we understand the question. So if we don't address it, it doesn't mean we're not going to. This question I know we can address. Does the pre-screening tool for service monitoring and T-beating need to be a part of the individual's record set? The pre-screening tool that we're using for TCM, does it need to be a part of the record set?
No, it's not an official record.
Okay. And then, Kim, can you repeat that again, what you just said about removing Appendix A?
Yes, sorry. So that is tied to that memorandum that we posted early on during the public health emergency on our expectations for reporting individuals who have COVID-19 positive test results. So it's embedded in that memorandum, and it's Appendix A, and it's a questionnaire that was, we asked agencies who are providing residential services to complete. So again, we're going to be reposting the revision to that memorandum next week. We'll be pulling that Appendix A and then directing you on where to go and report information on the DHSS link. And we'll just provide that right for you, so you can go directly on that memorandum to be able to report. But as a reminder, we still are asking that you also continue to report it as a reportable event in our Seymour EMT system.
Perfect. Thank you, Kim. Recognizing, and part of the reason you see these technology changes is we're recognizing this is going on for a while. We've had time to kind of build up some systems to collect the data that we need. And that data is important because that's going to drive decisions about how this funding gets spent. It really helps us make decisions, and I want to make sure you guys understand that. I know it's exhausting, the data that we ask for and the ways that we ask for you to submit it to us, but it makes a difference. And that, using that Health and Senior Services portal gets you access to a whole nother world of people calling and checking on you to make sure you're doing okay, and that's never a bad thing.
So for contact tracing efforts, all of
it supports everything we do, so it's really important. So thank you. We did get 2 additional questions, and we got no one over there now, so if you're sending any in now, we'll address them later. But the CARES Act funding for self-directed support families for tech, that is not included in the CARES Act funding? Yes?
I answered that one.
You did? Okay, never mind. I didn't know she answered that one. I was answering the other questions, so that's fine. Community testing. There was a question of when is that community testing going to start again and how is that funded? So that is state-funded testing. So you just show up, you get the test, you get the results. You don't have to pay. You don't have to have a doctor's note. And we don't have the locations, times, or registration. None of that is final at this point. When that is final, we will share that with everybody. But I appreciate your interest in community testing. So with that, I think we're good. So again, thank you guys for all you do. If you're in Southeast Missouri, I don't know if it's raining there yet or not. Stay dry. The rest of us will be watching out for you. I hope nobody has family members that were impacted by the hurricane. If you are, we're thinking about you. And wear a mask, wash your hands, social distance, screen, do all the things we need you to keep doing. You're doing a good job. I know you're getting tired. Thanks. Have a good week. Bye.